Hello everyone, my name is Megha and I will be conducting an information session on the new data collection and reporting processes that will be implemented for the conferences from the 1st of July 2014. Now, some of the changes that will come in place from the 1st of July are as follows. Now, there would be some minor changes to the forms that the conferences use, which we refer to as the forms A and B. The conferences will continue to enter the information from the Form A's and B's into a monthly summary form. So at least once, at least at the end of the month, the conferences have to enter the information of all the visits they did in that month in a monthly summary form. It can be completed on paper and it can also be completed online electronically on a spreadsheet. The conferences, however, will not be required to generate the reports anymore. So, because there will not be a need for the conferences to generate report, the regional summary spreadsheet that some of you might be working with till now, where you put all the reports, the reported figures of each conferences, you collate them and put them together in a regional summary spreadsheet, that spreadsheet will also become redundant. But what will happen is that once all the data is entered by the conferences in the monthly summary and subsequently in an electronic monthly summary spreadsheet, all that visit data and the client data will need to be forwarded to the State Support Office for the generation of reports and for analysis and for gaining insight on the work that our members are doing across the society. This on your screens you can see a summary workflow of the flow of the information and the process flow that will be in place from the 1st of July. So the conferences will continue to complete the Form A's and B's and the visitation notes and manage all the client files and all the other records related to the client. They will need to at least once a month summarize all that data in a monthly summary form. The conferences can summarize the monthly data, or summarize the data of all the visits they made in the month as frequently as they wish to, because they can do it after every visit, every week, every fortnight, but they need to do it at least once a month. Now, the conferences can either summarize the visitation data on paper, so there's a paper monthly summary form, or if they've got the capacity and someone with IT skills, they can summarize the data directly on an electronic monthly summary spreadsheet. So for conferences that do not have computers, they will obviously need to complete a paper monthly summary form. And this paper monthly summary then needs to be sent either to the regional council or to the central council, so that the data that is on paper gets transferred into the electronic monthly summary spreadsheet. It's important that all the data that is recorded, all the monthly summaries that are on paper, need to be transferred into the spreadsheet, either by the regional council or by the central council. And then subsequently this spreadsheet goes to the central council. For conferences that have access to computers and have the ability, some member who has the ability to use those spreadsheets, they can directly enter the information from Form A's and B's into the spreadsheet and then forward that spreadsheet on to their central council via the regional council. It is the responsibility of the central council to ensure that the data, the monthly summary data of all the conferences has been entered into the electronic spreadsheet. Once that has happened, the central council needs to email all those conference spreadsheets to the State Support Office. The State Support Office will then be storing all the conference data, all the conference visitation data in a central repository, and will be using all that information to generate reports and to gain further insight on the work that is being done by the Society across New South Wales. And all those insights and all those analyses will be shared with the conference members via the central councils, so that they can see the amount of work that they're doing, the impact that they're having on the ground, and and how they can possibly improve on that and provide much more effective support to the people in their communities. Now let's have a quick look. Now let's have, if you want to go into the details of the changes, let's look at the Client Information Form A. First, Form A, as you all know, provides the conferences with details about the primary client who is being assisted. So a primary client is that one person in the household who is seeking assistance on behalf of his or her household. If both partners contact the conference separately and you know that they are partners, clarify if they're living together and if they're happy to have a joint file. Separate forms should be filled for partners or for people who are not living together. So basically it is that one person in each household who should be recorded as the primary client. Now this Form A needs to be completed for every new client who or for any existing client who seeks assistance from a conference and for whom this Form A has not previously been completed. This Form A can be identified by the version number, which is version 2014.1. So any client who does not have a Form A, which is in this version, they need to, this new Form A needs to be completed for them. Unfortunately, this does mean that clients whose information is recorded on the Form A's that are currently in use in the financial year 2013-14, their information needs to be transferred onto the client information, on this new Client Information Form A. This form, obviously, it records the basic details of the primary client being assisted. This should be confirmed. The details on this form should be confirmed at each visit and should be updated if required. The first item that needs to be recorded on this Form A is the conference name and the location to identify the conference who is assisting this particular client. The date of the first visit is the date when the client first came to the society. If you do not know the exact date of the first visit, please enter an approximate date or the date when the Form A was first completed, which could possibly be the current date. In the client details, you capture, you record the information on the client's name, the first name and the surname, and the gender, date of birth, and the CRN number. Now the clients in the current form, the surname preceded the first name, so that position has been interchanged. So we've got the first name and then the surname. The client code is a code or identifier for each client, which identifies each client uniquely within a conference. This client code remains unchanged. The format remains unchanged. It is made up of the client's gender, their birth year, and their initials. So if a male client was born in 1981 and named John Smith, would have the code M81JS. If two clients have the same client code, for example, if a conference gets another male client born in 1981, but his name is John Shaw, his client code would be M81JS1. If you get another client with the same initials of JS, born in 81, and a male client, his client code would be M81JS2. So by adding that extra digit at the end of the client code, a conference is able to ensure that the client code remains unique within the conference. Now, the gender, there has been a change made to the gender following the High Court ruling. Now, there are three options to record a client's gender. You can either tick male, female, or not specified. Not specified needs to be ticked only when the client does not identify either as a male or a female. It should not be ticked when it's unknown or you're not sure or you haven't asked this question. It should only be ticked in those specific situations where a client does not identify either as a male or a female. So obviously the client code will also have three different, can start with three different letters. It can either start with the M, to denote the gender male. You can start with the F to denote the gender female. You can also start with the letter I to indicate the gender is not specified. The next piece of information that we collect on the client is their date of birth. If you do not know the exact date of birth, please record an approximate date of birth, but it is essential, it is mandatory to record the client's date of birth. Any item, if you notice, has an asterisk next to it, means that field, that data question is mandatory to be asked. You cannot simply, another thing about date of birth is that you cannot simply enter the year, only the year of the birth, or leave it blank, or put an XX where the year of the birth here is to be written. You have to enter the complete date of birth, and if you can approximate it if the client does not know it exactly approximate. The next question is the CRN, which is the Centrelink reference number. Not all clients have a CRN number, and neither do all conference members ask for the CRN number. But if you do, this is the place where you can record it. It's an optional question. In the next line, you can record the client's contact details, their phone number and their address, their residential address. If a client is homeless or staying at a non-private dwelling such as a hospital, please record the postcode that matches their location. The next piece of information that we collect on the client is their residential status. You have to tick only one box for their residential status, so they can either be Australian citizen, permanent resident, asylum seeker, or on a temporary visa. If they are on any other temporary on any other visa, please tick other. The definitions of the different residential statuses is provided in the guide to completing the Form A. Please refer to the guide to completing Form A, because that will more than likely answer most of the questions and clarify most of the doubts that you might be having on these questions. The next piece of information is on the client's indigenous status. You can tick one or more boxes. So if a client is Aboriginal, denoted by A, you tick Aboriginal. If a client is Torres Strait Islander, just TSI, you tick this box. If a client is both Aboriginal and Torres Strait Islander, you tick both these boxes. If the client is neither Aboriginal or Torres Strait Islander, you tick neither. And if the client is not willing to disclose that information, you can tick not stated. The next piece of information is the main language that is spoken at their home. So it can either be English, ATSI language, which means an Aboriginal or Torres Strait Islander language, a non-English language, and you can make a note of the language they speak. Or if you do not know, it's unclear what the main language is, you can tick unknown. If the person requires interpreter service, please tick requires interpreter service. The next piece of information that we need to collect on the person is their main source of income. Now, a couple of things that need to be kept in mind here is that this item refers to the client's main source of income only, and it refers to which means if a person is getting carers payment and they're also getting some income from their private savings, you cannot tick both. You only have to tick one box, which is their main source of income. So whichever, usually it is the one which gives them the more amount of money, more dollars. So if it's carer payment, you take that. If it's private savings, that's what you take. But you only take one main source of income. And the other thing is that you only tick the primary client's main source of income. So in the household, there can be other people who are contributing to the household and have got some other sources of income which might be higher than the client's main source of income, but that you do not need to check the income source of other household members in this Form A. This Form A only pertains to the primary client, so you only provide information for that primary client on this Form A. The next piece of information that we collect is the accommodation. So you have to record the client's living situation. So the person can either be homeless or in temporary accommodation, which means they're either rough sleeping in a boarding house, caravan park, hostel, refuge, staying with families, friends, etc. They can either be in rented accommodation, in government housing, in paying off a mortgage, in non-private dwellings such as a hospital, or living in a fully owned, privately owned dwelling. The next over here, in this space over here, you record their fortnightly rent, mortgage, or any other accommodation expenses. The next section, the bottom section of the Form A records the household details of that person. So if a person has got a partner, you tick that box to indicate that they have a partner. Then you write down the number of dependents that the person has. So the definition of dependents and non-dependents is provided in the guide to completing Form A. And the definition of dependent is all family members under 15 years of age, family members aged 15 to 19 years attending school, or aged 15 to 24 years attending a tertiary educational institution full-time. So any family member who falls in these categories can be classed as a dependent. And then any other person who is living in the household is those number of other household members needs to be recorded over here. So it can include other non-dependent children, relatives, parents, or probably family, friends who are staying in the household. So any other person who is not a dependent or a partner, their number, all their details should be, their number should be entered over here. The next piece of information that is really important for us to know is the household type, the type of household the client lives in. So, and you only have to take one box over here. So a person can either be single, they can be sole parent with a dependent, so it's a family consisting of a lone parent with at least one dependent who is resident in the same household. A couple with dependents, and other shared household is which means a household which consists of two or more related or unrelated adults over the age of 15 years who make common provision for food and other essentials for living. And if you do not know about the client's household, we can tick unknown if you're not really clear about it. Again, the definitions of all the household types are provided in your guide to completing the client information Form A. Now, this bottom section is an optional section, and it is up to the conference members to decide if they want to complete this section or not. In this section, you can record some additional details on the household members of the client. So if you can record their full name, their gender, and the date of birth. Often members use the space to record the name of the children so that they can give them age-appropriate presents at Christmas time. So if you've got any other person, you can say tick partner and put down the partner's name, tick child, put down the child's name, and tick other if there's any other person living in the household. So this completes the Form A. Again, I would refer you to the guide to completing Form A, which would hopefully provide you a bit more information on how you can complete the Form A. The next thing that we should probably look at quickly is how you can look at an exercise to complete the details of a person who has come to the conference. So we've got a client named Annabelle Citizen who first came to the society on 2nd March 2013. This is her date of birth, and she does not identify as a male or female. Annabelle is an Australian citizen, and her indigenous status is Aboriginal. She speaks English. Annabelle's main source of income is parenting payment, and Annabelle also gets financial support from her mother. Annabelle lives in government housing with her mother and has two children aged 7 and 11 years. In trying to complete the form for Annabelle, you just put down a hypothetical example of a conference, like Lewisham Conference, location Lewisham. The date of first visit was 2nd of March 2013. This is Annabelle's name, Annabelle Citizen. She does not identify as either a male or a female, so we tick not specified for her. And her client code is I78AC, where I is the gender, 78 is the year of the birth, and AC are the initials of a name. We make up just made up of address and phone number for her. The residential status is Australian citizen. She is Aboriginal. Her main language is English, and she is on parenting benefit. Annabelle lives in government housing, and just hypothetically, we'd say that her fortnightly rent mortgage is $500. Annabelle has 2 dependents, and she also has a mother living with her, which means that number of other household members is 1. She is her household type basically is a sole parent with dependents. So she is a sole parent with dependents, which is much more sort of. That's where her household type sort of leans towards, rather than another shared household, because she also lives with the mother. So you could argue that it can also be other shared household, but it's more because she has got dependents with her. It's much more. It's better to sort of the judgment call is to tick her off as a sole parent with dependents. And the details of a dependent are recorded here. We look at another exercise for John Smith. Let's try and complete another Form A for John Smith, who first came to the society on 3rd of March 2013. His date of birth is 18 September 1945. He's Australian and is not Indigenous, and he speaks English. He's on age pension, and his wife Mavis Smith receives carer's allowance, and he has a fully owned house. So again, let's hypothetically say that he is assisted by the Lewisham Conference. That's his date of first visit. His name is John Smith. His gender is male, and his date of birth is 18th September 1945. So his client code is M45JS. We capture his details. His residential status, Australian citizen. He is not Indigenous. His Indigenous status is neither. His main language is English. His primary income source is age pension, even though Mavis Smith, his partner, also receives carer's payment, but here we're only talking about John Smith. So his primary income is age pension. They have a fully owned accommodation. John Smith has a partner, so nothing stick independents or other household members. Their household type is couple, and this is the details of his household of his partner. So that's how the Form A is completed. Let's have a look at the Client Assistance Form B now. The Client Assistance Form B is the place where the conference needs to record the assistance that they give to a client. The Form B has got 7 columns. Each Form B has got 7 columns that allow the conference to record details of up to 7 visits that are made to a client. At the top, you've got the conference name and the location, the client name and the client code. By using the client name and the client code, you can link this Form B to the client's Form A. The first thing that you enter at the top is the member's initials. So the initials of the 2 members who made the visit to this client. You record the date of the visit. Then the next new piece of information that we have to collect is the referral source. Now this referral source means how did the person come to the society. So, and it has to be, it can either be a self referral or a family or a friend referred them. So in that instance, you record the code S to indicate that it's a self referral. You record the code I, you enter the code I over here in case it's an internal referral, which means that the person was referred by another St. Vincent de Paul Society service or a program. You put down the letter, you put down the code G if it was a government referral, like if someone from Centrelink referred them to the society. Non-government agency means if, let's say, any other charity or any other institute referred the client to the society, then you put down the code N. If it's any other agency, institution that referred them, you put O. If it's unknown, you put U. So you have to indicate, this question needs to be asked as to who referred you, what was your referral source at the start of each visit. And the definition of the referral is provided on the guide to completing Form B. And the definition of the referral basically means that unless a referral is an active, warm referral, it has to be regarded as a self-referral. By an active referral, we mean that if the other agency has got in touch with the conference or with the assistance center and informed them about this client and told them that they would be sending over a client who needs some assistance from Winnie's, that is a referral. If the other agency completes a referral form and sends it over to Winnie's, that again is a referral. But simply, if the client says that, well, I heard about you at Centrelink and that's why I thought I'll probably come and check if you can provide me any assistance, that is not a referral, because the client was left to his or her own devices to contact Winnie's. So Centrelink did not make a referral. If the question was, how did you hear about us, then the answer would be Centrelink. But if the question is, who referred you to us, the correct answer is no one. It's a self-referral. It's or you put it's unknown or other, or more than likely it's a self-referral. So if you so the definition of a referral is that if that another service gives us a call and puts the client in a call center queue, if the other service gives us a call and makes an appointment with us on behalf of the client, or asks us to give the client a call to get in touch with the client, that's a referral. If the other service physically accompanies the client to our service, that again is a referral made by that other agency to us. So it always has to be an active referral. If it's not an active referral, it would possibly fall under a self-referral if the client on his own has taken that initiative to come and contact Winnie's. So the next piece of information that needs to be recorded at every visit is the client's circumstances. Now you can take more than one client's circumstances, and it's a really important piece of information because it helps us to understand what the issues are, what the needs of the client are. For example, so the different things that they might be facing eviction, they might be homeless, so accommodation could be the issue. They might specifically have issues paying their energy bill. They do not have enough money, or they've been disconnected. So at that time, energy bill is an issue. If they've got any other bills that they're unable to pay, like water or phone bill, or any other debt collection issues that they're having, that's their circumstance, that's other bill or debt, that's what you take care of. If they come to the society specifically asking for food, their client circumstance, their presenting need is lack of food. Likewise, there's health, material, relationships, social, all are the different, these are the different sort of groups or different types of presenting needs that a client can present us with. If a need doesn't fall in any of these, you can tick the other box to indicate that there was some other need that could not be sort of slotted in these other options, in those other groups. It's really important that this information is collected as accurately as possible, and it should not be, and this is not the place where you record the assistance that is given. This is the place where the need of the person should be recorded. And because if we know what the need of the person is, and the members can see, and there's also at the bottom you record the assistance that you give, there can be a correlation between the two, and there can be times it gives us valuable information on the number of times and we are not able to meet the need. So it gives us a idea gives us an insight into the unmet need in the community, and obviously that will lead into discussions and ways on how we can reduce that percentage of unmet need. What do we need to be doing as a society, as members, to fulfill that unmet need? So it's really important that the client circumstances are recorded as correctly as possible, so that there can be analysis done, insight gained on the needs that are being met and the needs that we are not able to meet, and the things obviously that we need to do in order to fulfill those unmet needs. Now, at each visit, you also need to be recording the estimated household fortnightly total income. So this is the gross household fortnightly income. This is not just the income that the primary client gets, but it includes the income of the partner and any other contributing member of the household, which will give us will give you an idea of the amount of money that each person that the client has or the household has at the start of the fortnight, and how that gradually dwindles down, and then how much are they left with at the end of the day, and which would probably also help you in making an assessment of how much assistance needs to be given to the client. The next piece of information that needs to be recorded at the visit is, after the assessment has been done, is the amount of assistance that the members will be giving or give to the client. So you can record the material the dollar value of the material assistance that is given away. So if you give out EPA vouchers, you record the dollar value of the EPA voucher. If there's assistance, monetary assistance provided to pay the energy bill using other funds, so any other non-voucher, if you go and buy bottled gas or wood for someone, that you record the dollar value of the amount you spent in paying for in meeting the energy needs of the client. For water vouchers and non-voucher payments, and so any assistance that you give to a client, whether be it using vouchers or be it using the society funds, all of that has to be recorded in this box here. Likewise, for phone, any assistance given for paying the phone bills by using Telstra vouchers or any other means, all of that has to be combined, consolidated, and put in one column here. If any food vouchers or cards are given to clients, the value of the cards needs to be recorded here. Any food parcels that are, or any food packs, or any food, bread, anything that's given to the client that is purchased by the conference, the value of that needs to be recorded here. So if a food parcel, if a conference gets some donated food and which it gives away to the clients, the value of the donated item or donated food should not be recorded here. It's only the food parcel or the food items that are purchased by the conference, the value of that needs to be recorded here. The value of the donated items need to be recorded in a separate place on the monthly summary, and we'll get to it soon. Likewise, clothing or household items that were purchased by the conference and given away to the client, that value needs to be recorded over here. If the clothes or the household items are coming from the center, that's from the Vinny's shop, the value of that does not need to be recorded here. It's only the clothing and household items that are purchased by the conference, not donated and given away, or not the ones that are provided by the center. Only the conference values needs to be recorded here. Likewise, for medical, accommodation, transport, other material assistance that the conference gives out needs to be recorded in this section. Now, apart from the material assistance that the conference gives to a client, there's a lot of time that members spend in providing some non-material, intangible assistance to the clients. So, for example, they can be doing some energy advocacy. For example, a client has a huge bill and they're probably helping sort that bill out for the person. They're giving Yvonne a call, calling energy retailers, putting them on a payment plan or doing other things. So all of that classifies as energy advocacy, and if you do that, you need to tick here. If you simply call up the energy retailer as part of the EPA assessment process, that is not in energy advocacy. But if you go beyond simply checking the balance on the client's bill and do a bit more on behalf of the client, that will be energy advocacy. The next thing is other non-material assistance. For example, apart from energy advocacy, you might be doing some advocacy on other issues for the client. You might be helping them fill up forms, provide them social support, take them to some other place, or take them shopping or do something for them. That's then you should be taking non-material assistance. And also, if you provide, if you fill up the order form for a client, so that they can get some household items or some goods from the Vinnie's shops or the center, you should tick this box here to indicate that you have given them a service. You're actually not, because you're not actually physically giving them the goods, or it's not coming from it's not being purchased by the conference, but you're still providing them with a service and of completing up an order form so that they can go and get their goods from the center. So if in that cases, so anything that you provide to the client through the center, you tick this box here to indicate that that's the assistance that you have given to this person, provided them with the service, so that they can get their goods from the Vinnie's shop. If at the end of the visit you do not think that there was a need for the person that you can address, or the client probably did not need any assistance and you ended up giving them no assistance, which is perfectly all right to do, you can take no assistance given. Now this is one direct assistance that happens. So this is direct interaction, direct support that is provided by the conferences at a visit. But there's much more support, indirect support, that a conference can provide to the client, and that is by means of referral. By referring the clients to other services and linking them up with other programs and other services that can further help the client to come out of the situation that they are in. Because at a visit, handing them things, doing stuff for them would probably be a direct sort of assistance you can give, but there can be a lot more budget counseling things they can do. They need to go into gambling help, they need to be looking at employment opportunities and stuff, and things that probably there are much more specialized other services that can provide them much better service compared to our conferences. So if you identify that sort of a need for a client and you refer that client to those appropriate relevant services, that's another form of assistance that you're providing to the client, which is really, really useful for them. And that needs to be captured in the referred to, that should need to be captured in the referred to section. So if you refer a client to an internal service, which means any other society service like budget counseling, or to the homelessness, special work someplace, you record the number of services the client was referred to. If the client is referred to an external service that's outside of the society, you record the number of services you referred that person to outside of the society. Now again, I take you back to the definition of a referral, which is in your guide to completing client assistance form B. A referral is a referral involves transferring the client to another person by putting the client in a call center queue. It is about letting the other person know about the need of the client and making an appointment with the other service on behalf of the client, or asking the other service to make contact with the client. Referral is also actively referring the client in a live three-way conversation with the other service, yourself and the client. This might include introducing the client, explaining what has already been done and why they are being referred to. And also, if you physically accompany the client to the other service, that also classes as a referral. But if you simply give the contact details like a brochure or visiting card of a service to a client, that is not a referral. Referral is not a situation where the client is left to contact the other service. Like I initially said, giving the Vinnie's order form to go and to collect some goods is not a referral. It should that those instances should be recorded in the other non-material assistance that you provide. It is not classed as a referral. If a client, for example, telephones a regional center, regional office, and requests for a home visit, and the person at the regional office simply organizes for the visit to happen, then they are not it is not classed as a referral. They're just doing the administration part of organizing the visit. If a client comes in a regional office and they and the regional officer completes the Form A, or collects the basic information of the client and then passes that information onto the conference for conducting a visit, again that is not a referral. Only if the regional officer sits down with the client, does an assessment, and goes through the tries to so that it can be classed as a visit. And when they complete the Form B, that's when it is. That's when they are providing. The regional officer is providing assistance to the client, and if at the end of the assistance they think, okay, this person needs much more support from the conference, that time it is classed as a referral. So if a client is interviewed at a center, the regional officer tries to help the person, provide them some support, but at the end may or may not end up providing them with the support, but they then they refer them to the conference. That is classed as a referral. Simply collecting Form A information, completing all the details and forwarding them on to the conferences does not classify as a referral. The next important piece of information is where you record the visit duration, which means the total length of time that was spent by the members with the client, which includes any necessary follow-up work. So if you spent, so you have to record the amount of time you spent with the client face to face, and any other follow-up work you had to do, any phone calls you had to make, any forms that you had to complete, so on and so forth. All of that is put together as a total visit duration. That's the amount of time that's spent on the visit. It excludes travel time. And the reason it excludes travel time is so that it is because across New South Wales, some conferences do visits at centres, and some conferences are still doing visits at clients' homes. So in order to be able to compare the visit duration across New South Wales, it's much more easier if we had that one common standard, so that we're comparing apples to apples. So going forward, the total visit duration should only be the amount of time spent with the client face to face, including necessary follow-up work that has to be done, and excludes travel time. If there are two members, then usually there are two members on a visit, but the visit duration should not be multiplied by the number of members during the visit. So if two members visit for 30 minutes, it should be recorded as 30 minutes and not as 2 times 30, which is 60 minutes. Now that concludes the Form B. The other thing, when the members are on a visit, they obviously they will be talking to the person, getting to know them better, getting to understand the circumstances better. They will be getting a lot of information and knowledge on that client, which obviously cannot all be recorded on the Form B. But in order for that information to be made available to all the conferences, so that next time when another conference member goes to visit that same client, they at least have some background on what happened on previous visits. So there's all that information should be recorded, all that extra information around the client and their circumstances should be recorded on the visitation notes. So each client file should have visitation notes where the members are able to record, make factual notes of observable things that they observed during the visit, to help other members in the conference gradually develop an understanding, build up an understanding of the client and their circumstances. And it's really important that all these notes are observable and factual. For example, if um, you need to mention John indicated he was receiving treatment from a GP for depression. It should not be it should not be that John seemed to be depressed, because that's a judgment thing. The first statement is more of a fact that the client told you. Another thing, another example is you need to if Mary was you need to mention Mary cried frequently throughout the visit. It's not appropriate to mention that Mary was very upset during most of the visit, because this is again a judgment on your behalf, and this is a fact that was visible during the visit. So it's really important that all the visitation notes along with Form A's and B's should be completed appropriately, so that information, so we're gradually able to develop the information and knowledge on the client and the circumstances amongst all the members in a conference, and so that each conference member is able to thoroughly support the client if a regular member who is visiting the client is, for example, not available on a day or so. Now let's have a look at the example on completing the Form B's. Now we had initially completed Form A for Annabelle Citizen. Now on this screen you will see an example of exercise on Annabelle Citizen who was visited 2 times in the month of once in the month of July, and sorry, the second visit is also in the month of July. So we record that, all the details, the date of the visit, ignore this error. This is actually 17th of July, it's not 17th of August. There's a referral source, it was a self-referral because no agency contacted Winnie's to make a referral. Client circumstances, there can be more than one. You estimate, just put an estimated hypothetical fortnightly income. She was provided a lot of material and some non-material assistance, and she was referred to 2 internal services and 1 external service, and amount of time spent was 60. Likewise, we also complete the information on the second visit. And we have John Smith. He was also he was visited on the 3rd of July 2014, and because he was unable to pay energy bill and he needed food. He's given EPA vouchers, non-voucher assistance. He was given $20 of food vouchers, $70 of food parcel, out of which $20 of food was donated. He was also given some help to set up Centerpay and referred to budget counseling and legal aid service. So we record the visit details, visit referral by Centrelink, so it's G to denote it was a government agency that referred him. So he said that he was having problems paying the bill and he also did not have enough food. So these were his presenting needs. This is the amount of assistance that was given: $100 of EPA, $100 of energy, $20 of food voucher, and $50 of food that was purchased by the conference. In total, he was given $70 worth of food, but only $50 worth of that food was purchased by the conference. The rest, $20, was donated, which will be recorded elsewhere. He was given some help in setting up Centerpay, and he was referred to 1 internal and 1 external service. So that concludes our session on Form A's and Form B's, what the changes are and how these need to be completed. Now, each conference obviously will have their own system of organizing the client files. Three options that are there in front of you that we'd like to mention are that you can either maintain paper files, where you have got these manila folders in which you can file the Form A, B, and the visitation notes on each client. And you can print the Form A's and B's on separate A4 sheets of paper. The second option is that you can print the Form A's and B's back to back on the same sheet. The third option that everyone has is that all these Form A's and B's can also be completed online. So you can maintain online folders or online electronic folders on each client, so which avoids the use of paper. Now you only have to print out the paper when you're going on a visit, but you can have all your filing electronically. In order to complete the forms online, you need to download the Adobe Reader 11 from this website. So if you simply go to www.adobe.com, and over there'll be a section of says download, and you have to download the Adobe Reader. When you click on it, it will install it for you, and then it's pretty easy for you to have those electronic files. I can show you the example of how you can do. For example, I have created 2 folders. I have one folder for Annabelle Citizen with her name and her client code on it, and I open it. I've got a Form A, and then you can have multiple Form Bs for Annabelle Citizen. The Form Bs can be dated with the date of the first visit and the date of the last visit if it's already completed. If the Form B still has space to record visits, you can leave that last visit date as blank. So it means this indicates to me that it is my current Form B that I need to work off. Once this is complete, I'll put an end date to this Form B and then start a new form on the new visit date. So likewise, so you can create folders for each client, and in that folder you can have the Form A's and Form B's, and you can update the Form A's if and when the information changes, or you can date the Form A's so that whenever there's a change, you create a new copy of the Form A, and you always make use of the current Form A. So that was pretty quickly a quick session on how you can organize client files. It's up to the conference to decide how they want to go ahead with the organization of the client files. Now the next thing that I mentioned at the very beginning was that the conferences have to complete the Form A's and B's and the visitation notes, and then at least once a month they have to summarize the information on all the visits they did in a month in a monthly summary form. Now this monthly summary form can either be completed on paper, or it can be completed on a spreadsheet. There is a separate video tutorial that explains how the electronic monthly summary form can be completed. Please refer to that if you will be entering information directly on the electronic spreadsheet. But if you will be entering the information on the paper monthly summary, we will shortly see how you can do that. Few things that you need to note about completing the monthly summary form is that if the clients are visited more than once in the month, each visit needs to be recorded in separate columns. So 1 column per visit. And eventually, once the information has been entered into the paper monthly summary, it has to be entered by someone, transferred by someone at the regional or the central council level into the electronic spreadsheet. So the monthly summary cannot stay in paper forever. It has to be transferred from paper into the electronic spreadsheet, so that it can be utilized. Now let's have a look at what the monthly summary form looks like. The monthly summary form, which is called the visitation monthly summary form, looks more or less similar to what we currently have. So on the visitation monthly summary form, you record the conference name, location, the reporting month, year, and the person who is completing this form, so that they can be, if there's any questions, the handwriting is not clear or whatever, these people can be contacted. So for each client, you record put down the client code, the date of visit, the postcode they were in, they lived in at the time of the visit that was made, and then rest of the information from the Form A and B, like the residential status, indigenous status, main language, primary income source, accommodation, household type, partner and other household, number of partner and other household members. So till here the information comes from the Form A. Now please record the information from Form A that is current at the time of completing the visitation summary. Now let me explain it to you with an example. Now let's say, for example, a client was visited 2 times in a month, and reported his main source of income as New Start at the first visit, but was on no income at the time of the second visit. The Form A will obviously be updated to reflect that now the client's main source of income is no income, basically. Now, if the conference is populating or recording, entering information in the monthly summary after every visit, the client's income source will be recorded as New Start for the first visit and no income for the second visit. Now, if the visitation monthly summary is populated once a month, the client's income source for both the visits will be recorded as no income, as that is the current data at the time of completion of the visitation summary. So whatever information is there on the Form A has to be at that point in time when you're completing the monthly summary, that very information has to be transferred onto the monthly summary. So again, it depends on the timing of when you enter the when you enter the information in the monthly summary. If it's after every visit, so every visit information, if there's a change with every visit, it'll be recorded here. If it's not, if every fortnight, whatever is the situation at a fortnight or at the end of the month on Form A, that's what gets recorded over here. The other things you need to enter from Form B are the referral source, client circumstances, assistance given, referred to, visit details. On this monthly summary form at the bottom, you also have the donated goods summary. So this is where you record the estimated whole dollar value of donated items that were given to the clients in the month. So the $70 that we initially gave to John Smith, and out of that $20 was donated, so that $20 figure gets recorded over here. So you have to keep a note somewhere, or probably the conference treasurer or someone is making a note somewhere of the donated items that are given away, and you just have to put an approximate value of the amount of the dollar value of donated goods that were given away in the month. Now during the month, apart from doing assistance visits, the conference might also be doing other visitations like visiting hospitals, prisons, aged care, and so all the details of the visits, those are the visits that you did, the visit duration and the number of members who visited each day. Number of visiting members for each visit needs to be recorded in the conference visitation summary here. During Christmas time, usually it's November, December, when Christmas hampers are given out, this is the section where you record the details of the Christmas hampers that were distributed to the people. Till now, this particular page that you can see is pretty straightforward, and it's similar to what is currently in use. But there's one addition to the visitation monthly summary, and that is the introduction of a monthly summary cover sheet. Now, in this monthly cover sheet, if I may say, it's just like a fax cover sheet. So when you send out a fax, you put a cover sheet and say that where you summarize and say attached are the list of are the details of the people who were assisted in the month, and then you provide the names and the details of the people who were helped in the month, and then the visit details, the more specific visit details are entered on this visitation monthly summary. So on the cover sheet, all you have to do is you put the client code, you put their first name, surname, their gender, date of birth, and date of first visit. Now, and then, for example, it does not matter. Even if a client is held 3 times or 2 times, you only make one entry for that client over here, saying that this client was held in the month, and then for further information on the assistance given, visit details, we refer to this other sheet over here. Now, the other thing about this is that if the client details had previously been provided using this form, you do not need to list them again. It's much easier explained with an example. Let's say Annabelle Citizen came to the society in the month of July and in the month of August. Now, when she comes in the month of July, that's the first time in the financial year, you enter her details over here. her name, gender, date of birth, date of first visit, and then you provide the visitation details over here with the client code. And send this information over to the regional or the central council, and from where this information is transferred into the electronic spreadsheet. Now in the month of August, when Annabelle Citizen comes again to the conference for assistance, the conference members do not need to list her name over here again. They can simply go into the visitation monthly summary sheet here and put down a client code and enter all the other visitation details for her. The reason for this is that once the client information has been provided through this sheet, through this cover sheet, it gets entered into the spreadsheet, and that's where it stays. So by using the client code, the I78AC, for example, for Annabelle Citizen, the person doing the data entry can retrieve that information and pre-populate the fields automatically. So this information does not need to be provided every month. It only needs to be provided for the first time when a client comes to the conference in the financial year 2014-15. The reason we require all of this information is, and you will get to learn a bit more about this in the next tutorial, which talks about completing the electronic summary spreadsheet, and the reason we require all this extra information is that the client code that the conference generates is unique within a conference, but once all that information is put together in one central repository, it's highly likely for the client code that was the client code of one conference being duplicated in several other conferences, because there can be lots of clients with the same initials, same gender, and same year of birth. So in order to avoid that duplication of clients, and in order to keep the clients unique at the state, at New South Wales level and the Central Council state level, the name and the date of birth are used to, the name and the date of birth and the gender are used to come up with a further unique identifier. So the spreadsheet, the system, once this data is entered into the spreadsheet, the system will automatically generate a unique identifier for each client, making it possible for us to de-identify each client and at the same time keep each client unique. So keep all John Smiths born in 81 and who identify as male unique from each other. So that's the basic purpose of collecting this extra information, in order to develop a further unique client code for each client. And this only has to be, this is like a cover sheet, information, like I said, only has to be recorded once. Once it's entered into the spreadsheet, you do not need to provide this information again. So one best practice is that once you have recorded the details of the client in the cover sheet, for example, for Annabelle Citizen, you can probably make a mark on the Form A for Annabelle, just reminding yourself that you do not need to provide her name and gender and date of birth again in subsequent months when she comes back for assistance. So let's have a look at an example. Remember, we completed we provided assistance to Annabelle and John Smith. So let's have a look at how this monthly summary form would look like. So it should be 7. My apologies for this. So Annabelle Citizen was visited 2 times in a month, and John Smith was 1. So you've got 2 columns for Annabelle Citizen. All the details from the Form A are recorded here. On computer, when you complete this on computer, it's hard to put a tick, so you can just put a 1. Tick 1 box, or if you're doing it with paper, it's easier to put a tick. So tick 1 or tick whatever works for you. All the other details are entered over here. Referral sources for each visit, assistance given, visit duration, donated goods summary. So $20 was given away in the month to John Smith, so that's where it gets recorded. If any other visitations were done in the month, they get recorded over here. The monthly cover sheet looks like this. So Annabelle and John's details are entered on this sheet, and then they're sent over to this whole summary will be sent to regional or the central council, who will transfer this information into the electronic spreadsheet. If Annabelle or John come the next month as well, in the month of August, you do not need to provide their details on this cover sheet. Okay. It's only the new clients or the clients who come for the first time since the 1st of July 2014. Their details need to be entered here. So that concludes session on information session on the new data collection and reporting processes, where we talked about the new forms, the new reporting process, the monthly summary. There's another video tutorial which explains how the electronic summary spreadsheet works. Please refer to that. For all the forms and the monthly summaries, there are guidelines that you can refer to if you've got any questions or any doubts. But if you need any additional support, please contact any of those 3 people that you can see on your screen at the moment. We would be glad, more than willing to help you and provide you with any additional support you need. So please do not hesitate to give us a call or send us an email. Thank you all for listening, and I wish you all the best.